A man suffered from low back pain, yao tong, for more than half a month. The pain was along both sides of the spine, exacerbated by movement, and he did not dare to excessively stretch his body. He could not stretch out flat when sleeping and dared not sit on a stool. Squatting down and bending the waist slightly relieved the pain. The patient reported a history of twisting his waist, nü-yao, 20 days prior while pulling a cart. The color of his tongue was pale white, fan bai su, and the surface of the tongue had a large amount of fluid. When sticking out his tongue, it appeared as if water was about to drip from the surface. The doctor considered that the patient, being elderly and physically weak, lacked sufficient internal thermal energy. After physical exertion, sweating occurred, and the jīng were invaded by external wind and cold, causing obstruction of the jīng. The inability to straighten the body was due to wind-cold-induced contraction of the jīng. Therefore, the treatment principle was to dispel wind-cold, unblock the jīng, and restore the internal warmth. The physician used ma shuang fu zi qi xin tong and shui yao gan cao tong as the foundational prescriptions. First prescription, yi jun, 1 day's dose. Ephedra stem, ma huang, 10 grams. Prepared aconite root, zhi fu zi, 15 grams, pre-boil. Asarum root, xi xin, 10 grams. Red peony root, chu shao yao, 30 grams. White peony root, bai shao yao, 30 grams. Honey fried licorice root, zhi gan thao, 30 grams. These medicinal materials were mixed and decocted into a soup. The patient consumed the soup twice daily. The physician prescribed a total of 3 days of medicine. After taking the medicine, the pain was greatly reduced, and the patient was able to stretch his body, but he was sweating excessively. Second prescription, 1 jun, 1 day's dose. The doctor kept the same prescription but adjusted the dosage of each herb as follows. Ephedra stem, ma huang, 6 grams. Prepared aconite root, zhi fu zi, 20 grams, pre-boil. Asarum root, xi xin, 10 grams. Red peony root, chu shao yao, 60 grams. White peony root, bai shao yao, 60 grams. Honey fried licorice root, zhi gan zhao, 30 grams. The physician prescribed another 3 days of medicine. After the patient finished all the medication, the illness was completely cured. Hints. Number 1. Jīng is a TCM Zhongyi term referring to the pathways through which the body's qi and shui operate. Shui is a TCM name referring to a highly refined substance produced after the qihua, essential transformation, of fine matter. It is responsible for nourishing and moistening the whole body, and it is also the material foundation for our spirit and mental activities. Shui is distinct from blood. Qi is a TCM name referring to the microscopic substance in the human body that is highly dynamic and constantly moving. It includes the air we breathe, or hu xi di qi. This qi drives and activates various physiological activities of the human body, including metabolism. The cessation of qi movement signifies the end of life. Some substances in the human body are constantly present but invisible, and some only exist while the body is alive, such as the qi for breathing. Number 2. Ma shuang fu zhi xi xin tong and shui yao gan cao tong are names of ancient classic herbal prescriptions. A question for discussion? Number 1. The physician stated, the reason he dared not stretch out flat was that the wind and cold caused the jīng to contract. Can the cause of the illness be further refined?